industry kind of a tough game these days?
Afford to sit in my apartment getting baked, watching porn, and going to Tommy's Chili Burgers at 3 in the morning. That's not even...
Those are some scenes from This Is 40, which is kind of a funny movie about hitting those birthdays, and life changes in many ways, and one of them is how you look when you look in the mirror.
Right, so we have
how you feel.
Dr.
Yes.
Youn. So we let him know earlier some of our issues, be it, you know, veins, spider veins, or varicose veins, cellulite, as you mentioned earlier, bags under the eyes. I've already cornered him about the little,
the little pooch.
the little pooch.
Well, let's start with that, Q. Let's start with that. So for women who are gaining weight, let's say, Dr. Youn, in their tummies where they didn't used to have that problem,
right.
Is surgery the only answer? Or?
It isn't, actually. Now, there aren't any really inexpensive options other than diet and exercise, but there actually are a number of new fat-reducing options now that don't require surgery. There's one called Cool Sculpting, another one called Liposonics, another one called Vanquish. So that's actually one of the hottest things in our field right now, is losing fat without dieting, exercise, or surgery.
And how does it work?
Yeah, they work by irreversibly damaging the fat cells, and then the body actually will clear those fat cells on its own after a couple of months. The problem is that the results are not super dramatic. You may lose about 20 to 25% of the thickness of the fat, but the scientific studies are actually pretty consistent with most of these treatments.
And the cost is an issue too.
Right, and you can use like 20 to 25% with one treatment.
So you
do
can
most people do just one treatment, or do they do?
Most people do, but you could do more than that, and it kind of depends on the body part. And so certain devices work for certain body parts, certain devices others. We recently came out with a treatment called Kybella. That's an injection into the double chin that melts fat, and we've had great results with that. Just do it in the office. It literally takes 3 minutes for the injection.
But Dina mentioned cost, so let's talk about the cost of these options.
Yeah. So any type of procedure, whether it's surgical or even non-surgical, especially if you're dealing with technology, is going to be expensive. So a Cool Sculpting treatment of the lower tummy probably runs anywhere from $1,200 to $1,400.
Right. Now,
so it is an investment.
Right. Now, how does that relate to, or how does it compare with liposuction?
So surgery, you're going to pay for the operating room, the anesthesia costs. You're going to pay for a surgeon there. So now you're going to be looking probably closer to $3,000, even more, depending on how much you have done.
There's probably not as much downtime with the Cool Sculpting as opposed to lipo.
Exactly.
But lipo will get you more. You'll get more fat.
So if you're dealing with a number of different areas, then lipo can, in the end, be better. But if you don't want to have surgery and you just got an isolated area, just the love handles, just the lower tummy, then that could work nicely. But it doesn't tighten up skin. So one thing you guys were talking about is, I've had kids and there's loose skin. I wish I had a good solution for that other than a tummy tuck. But right now, that's one of the things I'm hoping that the laser companies really continue working on, are skin tightening lasers. Right now, those treatments are very painful and not very effective. So I don't usually recommend people do that yet.
And when you talk about lasers, let's talk about people who have darker skin with lasers. There's an issue with that, with keloiding, right?
Yes, so really with keloids, also with changing of pigment. So laser deals with heat, and if you apply heat to darker skin, you can get inflammation, which turns dark. So like if you and I, if we get a pimple, it turns dark and it stays dark for months. If you get one, Monica, it's probably gone within a week or two.
I wish, but
well, the redness though disappears with lighter skin. So with lasers, same thing. Damage to the skin, you can create pigment problems that can last for a long time.
You have to be careful.
Very careful with darker skin.
Let's talk about my cellulite issue.
We all have issues with that.
So cellulite, there's no actual solution to cellulite, but you can reduce it by treatments in the office. Those can cost $1,000 or more. This is one cream actually that my staff has had a lot of luck with, and it's a 9-minute cream, believe it or not. We've actually tested it on several television shows, and we've had some pretty good luck with it.
9 minutes?
9 minutes.
What does that mean?
You slather it on, and 9 minutes later, your cellulite is smoother, and they'll tell you like 42%.
I'm trying that today.
Right.
It does seem to work. Now, it is temporary. That's what you got to keep in mind. And it's the same idea as some people say, hey, I actually take old coffee grounds and I rub those against my skin. It can cause the skin to temporarily tighten by caffeine. Now, that doesn't have caffeine, but it's a very similar type of a thing.
How much is this?
That you buy online, it could be up $79, I think, for that one bottle. So it's expensive.
It's not cheap.
But all the less expensive ones, we haven't had much luck with, honestly.
Okay.
You brought some support stockings.
Okay, so now I'm finding the little spider veins that literally in the last year have just been popping out like crazy. I don't seem to have the big varicose veins. They're really painful.
The two kinds. So varicose veins are the puffy ones. And if it's puffy and severe and you have pain with it, see your doctor, because health insurance sometimes can pay for that with laser treatments.
Oh, wow.
Okay.
Spider veins are purely cosmetic, and the best way to treat those is to actually prevent it by using a support hose. Okay, so if you've got
now I have to start putting on the support hose.
But typically, if you have a job where you're standing for long periods of time, surgeons, hairdressers, nurses, you know, those types of jobs, security guards,
but we sit a lot,
support hose.
What about the injections real quick for veins?
You can inject saline into them. Okay, that's the safest way to do it. A lot of dermatologists and plastic surgeons will do that, or you can even laser them, you know.
But that's a process, so you have to have a number of treatments to get rid of them.
In general, with injecting it, you should see it disappear literally while they're injecting it into the vein.
And
with the lasers, a lot of times as well.
Spider or varicose or both?
Spider veins. Varicose veins are the big, thick ones.
Gotcha.
Those much harder to treat.
Do under eye circles before we run out of time.
Yeah. Okay. So and I have the dark circle issue as well. So
dark circles under the eyes. I actually on my website dryoun.com I give a newsletter, and we sent a newsletter actually yesterday about all the options for treating dark circles, and you have to target it to its cause. So it can be pigment, it could be puffiness, it could be
hydration.
And so what you want to do is target. So these are just two inexpensive options. This is one that contains caffeine. It's $13.50 you can buy at the drugstore.
And
caffeine
it works.
And it chills. So this is purely for puffiness. The caffeine will tighten it, and it chills the area. You know, like if you put a cold green tea bag over your eyes, can really work for the puffiness. That one, however, $13.50, is a concealer with caffeine. So if you have darker skin or if you've got pigment, that concealer can help to conceal the pigment as well as the caffeine to tighten it up. So you really have to target the treatment towards the cause.
Causing it though? How do you know?
Well, that's what. So there's three main things. Okay, it's either thinning of the skin. So for you, part of it, as you get older, you get thinning the skin. You want to use a retinol-based cream, eyelid cream that can actually scientifically tighten that skin. If it's your issue, then it's going to be more a pigment issue because you have darker skin like me. Then you want to use a lightening cream.
Okay, like hydroquinone or something like that?
Hydroquinone,
which I think some of my products that I do contain that.
But if it's puffiness, and you can tell because if you're in a dark room and you have very dim lights and it looks really bad, then it's probably more shadowing from puffiness. Then you can use a temporary solution like this, or it's surgery.
And you've got a new book out too that talks about a lot of this.
So it's the Age Fix. Basically, it's how to turn back the clock 10 years by diet, by what you put on your skin, and solutions to every single beauty and aging problem you can think of. It's out April 5th.
Does water really make a difference in 10 seconds or less?
Huge difference. Yeah, you got to hydrate your skin, and then products do help too. You lose collagen in your skin, you want to return it to your skin. Use the right products.
All right, start pumping the water.
Keep drinking your water. And getting some sleep too, right?
Sleeping good, sleeping and exercising as well.
Thanks for being with us, everybody. We want to hear from you. It's living the life. Are we going to continue our
We're going to continue our conversation.
So join us online on Facebook, and we hope to hear from you soon.
All right, have a great day, everybody.